guarding against cervical cancer, preventative measures, and early detection strategies. Namaste, friends. Cervical cancer is the most common cancer in women after breast cancer. Cervical cancer can be protected to some extent by early measures. Today, we will learn how cervical cancer can be prevented by following measures and early detection. First, let's understand what cervical cancer is. The part that connects the vagina to the uterus is called the cervix. Cancer that occurs in this part of the cervix is called cervical cancer. Primarily, the human papillomavirus, HPV, causes it. Cervical cancer is most likely to affect women in their 30s and 40s. Cases of this cancer are rare in women under the age of 20. It is often said that prevention is better than treatment. If detected in time, cancer treatment will give good results. Cervical cancer can be prevented through regular checkups. Cervical cancer can be detected by a Pap smear test. Pap smear examines abnormal changes in cervical cells. A piece of mucus or a piece of tissue produced in the cervix is collected and tested through a device called a speculum. A Pap smear test not only diagnoses cancer after it is diagnosed, but also helps detect signs of cancer before it occurs. Based on some basic symptoms, like bleeding during the monthly interval, continued bleeding even after the end of the period, white discharge, pain during intercourse, abnormal bleeding from the vagina, and menstruation even in the menopause stage. Based on sound waves sent into the body, the behavior of abnormally moving cells is detected and their images are generated. Based on these images, it is possible to detect abnormal cells in the cervix. This is called ultrasound sonography. Cervical cancer and some other cancers have CA-125 antigens in the blood. A CA-125 test can detect these types of glycoproteins in the blood. A CA-125 test of more than 35 units per milliliter usually confirms the presence of cancer antigens in the blood. Early detection can reduce the risk of cervical cancer, acts as a powerful shield. It helps detect the presence of high-risk human papillomavirus HPV genotypes such as 16, 18, and 45. Cervical cancer can be prevented by vaccination against HPV. Vaccination is effective for girls aged 9 to 14 years. Women aged 21 to 65 should undergo regular screening. Cervical cancer affects many women every year. Awareness and early detection of this disease is important for women regardless of age. It is very important to follow preventative measures. Thus, early detection and preventative measures can protect against cervical cancer.